Good morning, everyone. This is Bill, the Oregon Loser. Just thought I'd check in this morning and give an update of what's happened since the last time I made a video. No numbers to report. Um, I don't trust my scale one bit, and I haven't been back to my surgeon's office since the last time, so I don't have any official numbers. If I trusted my scale, according to my scale, I've lost around 30 pounds. Don't trust my scale. No. Yeah, almost exactly 30 pounds. So I don't trust my scale at all. I have a new sweater on and trying to get used to a different collar than I'm used to. And so I have no idea how much I've lost. I definitely know I've lost. I've gone down one, maybe two notches on my belt easily. I've felt other things. This white shirt that I'm wearing, much easier to close. I don't need to use the stretchy button anymore to close it if I need to close it and wear a tie. It's much looser in the chest and the stomach. So I can definitely have some feeling that I'm losing, just have no idea. I go back in on, I think, next week to the doctor's office and just for a weigh-in checkup, see how I'm doing. I put my eyes in the wrong place. My eyes turned to glaring white, so I'll try to keep them up here or down here. So not sure how I'm doing there. I had this last Thursday, I did my endoscopy, and it went really well. I was a little bit nervous for it. I think I said that on the last video. I was nervous for it, trying to never have anything similar to that done before. So it's a little bit nerve wracking going up to it, but a lot of my friends and Getting Fit for Life helped me out, made me feel a lot more calm about it. Thank you, everybody. And it was pretty simple. My daughter drove me in. She's 17. She drove me in, and they called me back. They took my blood pressure, they took my pulse, asked me a bunch of questions. They got me into bed, and I was just laying there. They put an IV in, and then I laid there for probably about half hour, 45 minutes, waiting for my turn to go back to the procedure room. It was done not in the hospital, but it's called Sacred Heart Pavilions, Riverbend Pavilions, which is just a building right there on the same campus as the hospital. It's just actually right down on the same floor from my surgeon's office, and so it's just essentially right there at the hospital. So I felt safe, plenty of doctors around. And then they wheeled me back to the procedure room, and I met the doctor who was going to be doing the endoscopy, and he was great. Made me feel at ease. The nurses back there, all the nurses at the endoscopy center were wonderful to work with. Really helped me to feel a lot more comfortable. They asked me some more questions, a repeat of some of the questions that were asked in the front. Then he asked me some questions, and he had heard that they're all repeats, so he asked me some of the same questions just to give me a hard time, which was good. And they had me roll over on my side, and she said, we're going to start giving you some of the medicine now. I said, okay. And they had me roll over on my side. They put a towel down. They put the bite block around my neck, but didn't put it in. And then I woke up in the recovery room sometime later. I have no idea what happened. I was gone. And my daughter was in the room. My daughter said I waved to her. I went, and that's about all I did. Well, some of this is coming from my daughter. Don't remember it. The nurse came in, told me I did really well, things looked good. Then the doctor came in, and the doctor said everything went extremely well. He said I was the easiest patient of the day. Yay me. He said I've got the stomach of a teenager. Don't know if that's good or bad. I've seen what teenagers eat. Not sure if that's a good thing. My mouth is moving differently than it's moving here. Um, and so everything went well. They gave me a form that told me everything that had gone on. They'd taken a biopsy. I'll find out this week sometime, probably, for H. pylori, how that went. They gave me some pictures of my insides. It's kind of cool, kind of weird to be looking and knowing you're looking at your insides. I have to say that. It doesn't gross me out, but it's kind of like, wow, didn't know that's what a stomach looked like. Um, but went fairly well. Went home. Um, we got home about 3:30. I went right to bed. My wife got home from work at probably about 5:45, 5:30. I remember her coming in the bed and we talked for a while. My daughter came back in. We talked for a while. Um, she told me that as we were walking out from the doctor's office in the parking garage, she said I was walking a little different but fairly normal. And then this couple walked by us, and she said, after the couple walked by us, I leaned over to her and I said kind of quietly, I was walking weird, just to creep those people out. So, don't remember that. So I guess I like to creep people out when I'm in my true state. Doesn't surprise me any because I like to scare people and joke on people. Um, and then um, I fell back to sleep after talking to my wife and daughter, and I woke up about 10:30 when my wife came back to bed, and was a little bit hungry. Came out and had some water, a cheese stick. Thought, oh, I'll never get back to sleep now. Went back to bed. Fell asleep probably in about 3 minutes, and woke back up the next morning at 5 o'clock when my alarm went off. So I didn't have a problem going back to sleep. But everything seemed to go well. Did have some pain the next morning. Um, like a gas pain. It was moving, and but now it's Monday from last Thursday. Everything feels great. I think maybe just some of the air, or just my stomach getting used to. I don't know. Um, it everything seems fine. It seems fine now. Um, so that was my endoscopy. Um, I did get a letter from my doctor's office this week that they had met because they meet after you go to the nutritionist, the psychologist, the nurse, the doctor, and the patient coordinator. They all meet and then they discuss, should this person be part of the program? And I am. I got an acceptance letter that I am a candidate for bariatric surgery. Things are looking real good. So at this point, I think all I have to do is lose the remainder of the weight that I have to lose, be it 5 pounds or 30 pounds or whatever I need to lose, because I have no idea. And and then I need to do the 2 nutrition classes, but I can't do those until I'm within about 5 pounds of my goal weight. So I need to do those, and then I set a date. That's it. Not much more to do, but just watch what I eat. And I'm trying to watch what I eat by lower calorie diet than I've had in a long time. Not a low calorie, but a lower calorie, between 12 and 1500 calories. Higher protein, trying to get used to eating higher protein. Um, not no fat, but lower fat. Trying to watch where that protein comes from. So low-fat cheeses and low-fat meats, protein with low-fat milk. Just trying to watch so I'm not whole milk with that and getting just extra calories and fat that I don't need. Um, and it seems real easy. Not easy, but it's not hard. I'm not hungry, and that's what's important. So everything seems to be going real well. I'm really enjoying the sport. And getting to know people and meet people, and I look forward to the next step. I'll check back in maybe next week after I weigh in. Thanks everybody, and you have a wonderful day.